Welcome to Raaonline. I am Dr. V. Rajapriya, Professor and Head of Anatomy from Government Medical College, Thiruvallur. Today's session will be Clinical Anatomy and Screw Home Mechanism of Knee Joint. In the previous session, we read about knee joint, what are the features of knee joint, ligaments of knee joint, what are its movements, everything we read in the previous session. This session will cover mainly on the clinical anatomy and the movements of knee joint. Objectives: at the end of the session, the learner must be able to describe the anatomical basis of locking and unlocking mechanism of the knee joint. He has to describe knee joint injuries with its applied anatomy, and the student must be able to explain anatomical basis of osteoarthritis. Movements of knee joint are flexion, extension, medial rotation and lateral rotation. Mainly flexion and extension occurs, therefore knee joint is called as hinge joint. Since some additional movements occur with rotation, it is called as modified hinge joint. It is called as modified hinge joint. Flexion is reduction in the angle between the calf and the thigh and the calf muscles is called as flexion. There is reduction in the angle at the posterior aspect of the knee joint, that is called as flexion. Extension is increase in the angle between the back of thigh and the back of calf, is called as extension. Medial rotation is rotation of the leg along the longitudinal axis medially, and lateral rotation is rotation of the leg along the longitudinal axis laterally. Axis of movements of knee joint. Here you can see this is the transverse axis. This is the transverse axis, and along this transverse axis flexion and extension of the knee joint occurs, and along the longitudinal axis medial rotation and lateral rotation occurs. Extension of knee joint. Normal knees extend from 0 degree, this is 0 degree to 140 degrees extension. It is the straight alignment of axis of tibia. Straight alignment of axis of tibia and femur is called as extension. So the extension can occur from 0 to 140 degree. The straight alignment is the extension, and the extension occurs from 140 degree is a full flexion. From 140 degree to 0 degree, when the person tries to extend his legs, it is called as extension. Muscles involved in extension of knee joint can be classified into two groups, the primary muscle and the secondary muscle. The primary muscle is the quadriceps femoris. This muscle is called as quadriceps femoris. As the name indicates, quadriceps femoris is made up of four group of muscles. What are the four group of muscles? They are rectus femoris, vastus medialis, vastus lateralis and vastus intermedius, just deep to your rectus femoris. The secondary muscle which helps in extension of knee joint is your tensor fascia lata. So these are the muscles which are involved in extension of knee joint. Coming to some factors which helps in limiting the extension of the knee joint. They are anterior edge of lateral meniscus. You can see the lateral meniscus here, right? And this is a medial meniscus. This anterior edge of lateral meniscus and this anterior cruciate ligament helps in limiting extension. The anterior edge of lateral meniscus contacts shallow groove between the tibial and the patellar surfaces of femoral condyles. Both the tibial surface and the patellar surface of the femoral condyles, and it prevents hyperextension. Similarly, the anterior cruciate ligament, this is meniscus, this is a cruciate ligament present in the intercondylar fossa, also prevents hyperextension.